focusing on the health bill being debated now, joined by Dr. Njemanze, who is the chairman, International Institute of Advanced Research and Training. Thank you for coming on this morning.
Thank you very much.
Well, this bill, you've talked and written a lot about it, but from what they're saying, because the last time we spoke with one of those who was involved in these discussions, he did suggest that controversial section of cloning of the embryos had been expunged. That was a suggestion. Are you aware of this, and what do you think?
Well, actually, if you read the correct version of the bill, it still has that section 51.
Okay.
And even more so, not only does it, the section 51, what does this say? This says that it is legal only with prior consent of the minister, first and foremost, to kill an embryo. That's a full Nigerian citizen. With the consent of the minister, you can kill that Nigerian citizen. And the embryo is a full Nigerian citizen, just like you and me. Now, it will be legal in Nigeria. For the first time in human history, no nation has ever passed such a law. Now, this bill also says, because they use euphemisms, that is something that is less offensive.
Yeah, because I'm reading through that, and of course they can't use that word kill.
Yeah, they use the splitting. To split an embryo is to kill it. That's what it means.
So you don't split and it remains the same?
Absolutely. So when you split it, it's dead. So you can now use the cells for research. So what it says in the bill is that it will be legal for the first time in human history to kill a full citizen of the country.
That's subsection B, which says, let me even read it out.
Right.
It says, section 51B, a person shall not, without the prior written approval of the minister, engage in any activity including nuclear transfer or embryo splitting. Absolutely. For the purpose of the reproductive cloning of a human being.
Absolutely. And that's just what it means. You kill the embryo in order to undertake research in creating a new human being. So you kill one in order to give life to another. That's what the bill allows. Only what it needs is a prior consent of the minister. Now, this bill, for the very first time in human history, is authorizing the export and import of Nigerians. This is the transatlantic, the first time in human history you're going to allow biological slave trade. Now, this bill goes even further.
But are we not looking, sorry to interrupt you, Professor,
Yes.
but are we not looking at the extremes here? Because we know that whatever it is that can be used for human good can also be used for evil as well. All of the provisions that are here, one would not think that these are intended for evil in the very first instance, but we know that in extreme cases, or most times, most people will seek to manipulate, assuming this were to become law, manipulate this for their own selfish and evil intentions.
Yeah, but the law is very specific. It actually authorizes you to do that only with prior consent. Now, we are saying the minister has no place, not even the president of this country, to authorize the killing of any Nigerian. It's not possible. No nation has ever subjected that.
But this was put there with a caveat that you have to get permission from the minister. Doesn't it presuppose that you will be stating explicitly what you need it for in the very first instance, and that the minister will be able to decide if this is for the good of the country or not?
Well, let us just assume. Let us assume that you want it for the good, and you want to find the next cure for diabetes. Even if you state that and get a permit for that, so you can now kill the citizens of the Federal Republic of Nigeria in order to solve that problem. Now, let me even tell you why this was put there in the first place. Now, as we speak, there is a process called somatic cell nuclear transfer that perfects the cloning technique. Now, to clone, that is to come up with organs through the test tube manipulation, you really need at least 100 million eggs, embryos, 100 million by the major laboratories in the world. No country allows you to take the egg or the embryo from their own country. Britain bans it explicitly. If you take that in Britain, you are going to life imprisonment because it will be looked at as murder. The same thing with the America, the same thing with many Asian countries. So, where do you get the eggs from? And they have the laboratories. Everybody rushed to Africa.
So is Africa trying to create a market for all of this?
Absolutely. They actually have funded and have gone through into the legislative process in Africa, particularly Nigeria. Because if you allow this, you will have almost 10 million women. How would that happen? You give incentive, financial incentive. You're paying about 45,000 naira for each egg donation. When you do that, how much 45,000 naira would a person need who is in need, who is poor? Every other 2 months or every month or every other interval, we need that 45,000 naira. So the person will be going for this
donation.
Yeah, donation. And these people who have donated these eggs will die maybe in 3-4 years' time from liver failure, kidney failure, cancers, because the process of hyperstimulating the ovaries actually carries a medical complication, especially when you do it successively. So these people will die. So we are looking at, if we look at the number of poor people poor women in Nigeria, and you look at that number and look at the need for 100 million eggs in Western laboratories, that would mean that these eggs will be gotten from Nigeria. And you will have 10 million Nigerian women exposed to a risk of losing their own lives.
Dr. Njemanze, sorry, I need to come in here again.
Yes.
Aren't you sure that this is already happening?
It is already happening.
Without any kind of legislation?
It is already happening.
In Nigeria?
In Nigeria. In fact, Nigeria was cited in the European Union report of 2006 as an egg trafficking country. So many organizations were specifically mentioned. Nordica was mentioned as a network. That's the Danish company who has a whole network of IVF clinics in Nigeria. IPPF, International Planned Parenthood Federation, was mentioned in that report as an egg trafficking country. Now, how do you address that egg trafficking? It's not in the National Health Bill. There has to be a separate bill that prohibits the trafficking of embryos. It's not a system regulation issue. It is a prohibitive issue, just like you address human trafficking. So you can't allow it in the system regulation. What is in the health bill is not a prohibition. It's not even a regulation. It's permissiveness. You are actually allowing it. You're only stipulating some condition for it. Now, if you go further.
Yeah, I was going to ask, how do this happen? Because the United Nations General Assembly adopted this Declaration on Human Cloning on March 23, 2005.
Yes.
So wouldn't that be contravening that?
Absolutely. This bill is totally against all international treaties. The National Constitution of the Federal Republic of Nigeria is against the international treaties Nigeria signed on to. The Universal Declaration of Human Rights, this bill contravenes it in almost all its sections. So you can't even be talking, this bill has no legal footing, not at the international level or the national level.
The entire bill?
Yes,
or
and I can
because
tell
of the
you,
sections
let me
or-
just give you even further insight. When you get down to section 52 and 53, what does this say? It says that a doctor, you can order the removal of an organ